What you're about to see reflects what might have happened when 6 actors and a director came together to communicate the benefits of electronic care records.
Right, she's very breathless, she's been sweating, and I think she's having a heart attack.
Thank you, Sophie. OK, Maggie Green. He's got no cardiac history, but COPD.
And cut! Well done.
Edward, I've got a bit of a problem with the way we played that scene.
What's that?
Well, effectively, we're saying that ambulance crews are doing a bad job at the moment, aren't we?
No, we're saying that with this new technology, they will be able to do a better job.
So what if there are 2 people with the same name?
Name, postcode and date of birth will be enough in 99% of cases.
So, these things are really indestructible, yeah?
It's got a titanium casing.
And what if you can't get a signal?
Good point.
So in the bright, shiny new future, we saved this woman's life, but in the bleak Dickensian past, she would have died.
No, she wouldn't have died. Having access to a summary of her condition helped the crews give her better treatment, that's all.
Edward, what if it can't get a signal?
It will.
What, underground?
Well, then the crews will be in the same position that they are in now. They will have to make the best assessment from the information to hand.
A weird way of going about
make it perfectly clear what we're trying to
But
achieve.
you know what? I think it might be quite offensive to hard-working ambulance crews.
Right. No cynicism on this set.
Put your granny over there, all right? Hi, Danny. Hello. This is Maggie Green. She was about 70. She was found collapsed outside the Riverside Shopping Centre. Suspected MI, symptoms heart failure, pulse 172, blood pressure 172/96, and a respiratory rate of 34 on 100%.
Her pulse is 172.
Centre.
What the hell is that? Cut!
These tough books are really tough!
Leave the props alone, please. Sorry, Bill. From the top again, please. Action!
And you've given her oxygen at 4 litres per minute. And you are A139, aren't you, Bob?
That's us. Booking us in.
OK, done.
Records uploaded.
Done. Sorry, Edward, I don't know what I'm doing.
Cut! What is it?
Well, it's just that I'm tapping this thing here, but I've got absolutely no idea what it does.
Don't worry about that. Just do it as we rehearsed it.
What, so I just tap this thing here, and the information is just pinged into the hospital system?
That sort of thing.
Well, could you explain what this booking in...
Really? Can you actually do that?
Yes. Sort of. Not yet. If you want to know the details...
Yes, please.
At the moment, the Tough Book is linked to the ambulance service's own system, which can then be remotely accessed by the A&E staff in the hospital.
So it doesn't actually ping anywhere?
Look, it's happening right now in the east of England. A&E teams have full prior warning of what's coming in, and they then get the right teams and equipment standing by. Happy?
Thank you.
Great. OK, we can have Little Miss Sunshine on set, please. Right, we're cutting the ward scene into 3 sections. A change from your script because the new computerised care
2K
records...
monitor, that is seriously high res.
Yeah, I do. Yeah, it's fine.
Sorry, yeah, 3 sections, I'm with you.
The new computerised care records have 3 levels. A summary care record, a detailed record held locally, and patient access via HealthSpace.
3 new and exciting ways for somebody to snoop at my healthcare record.
Smart card. And each level has its own robust access. For a moment.
Robust. Such a politician's word. Basically means good until it goes wrong.
This can only be accessed from someone who has the correct smart card. Pin. Could we please have some attention for a moment?
Sorry, am I the only person here who's got a problem with this?
Yeah, well, I bet I could hack into that in 3 seconds flat.
I think it's very robust.
Look, you can opt out from having a national record.
Really? Well, then I think I will.
Yeah, but would you want to? Well, I think it's a really good idea. I thought they were doing all this stuff anyway, to be honest.
What I wanted to say is we have a new role, a nurse who asked the doctor if they put the X-ray request on yet, and Shamal says, of course he has, when he hasn't. It's a medical gag.
OK. I've just rung X-ray. They said, have you put the request on yet?
Yeah, absolutely. Now, are you seeing anyone about... No, bollocks, sorry, go back.
I haven't seen those for a long time. Do I need a note from a GP?
No need for that. This episode will go in your care plan, and then I'll send a secure email to your GP, and she, can attach a note to your summary, and you'll be able to see it on HealthSpace.
Hey presto.
Cut. Fine. Last scene now.
Food on casualties a lot better, but on Holby they give you a car home, because sometimes...
Danny, you ready for the next scene? Yeah. No, lose the wig.
Oh. Well, actually, I've just got a couple more questions on this HealthSpace business.
Again, with the questions. Why can't you all just do as you're told, like nice little actors?
We don't get it. How are we supposed to convince the people watching this epic piece of corporate communication?
Aren't you done
I mean,
for
the
the
thing
day?
is, the whole thing is implausible enough as it is anyway.
Graph all the blood results on this. I mean,
We
it's
heard it all
really...
before. I mean, this was supposed to kick off 5 years ago, but it's never going to happen now, is it?
Never happened. It is happening. 5 areas now have summary records. Over 150,000 patients' records have been done so far. A dozen trusts now running their software systems. Electronic X-rays in every trust in the country inside 2 years. Is that happening enough for you? What was it you wanted to ask?
Well, this HealthSpace business, this is where patients can access information themselves, right?
Right.
So what if the patient accidentally deletes all their medical records? Does that mean that they're like,
Dead? No, it doesn't. And no, it can't happen. Don't you think they might have looked at that?
I don't know who they are, do I?
They are the NHS doctors, nurses and patients who help design this stuff. They are you. Where's my old woman?
Why don't you just look on HealthSpace?
The computer thingy? Oh, I'm a bit scared of all
Oh,
that.
Mrs. Green, it's really very simple.
Cut! Is there a problem?
Well, I'm sorry, I think there is.
My contract says I have to be done by 5.
Look, it's been a long day. Can't we
No,
just...
I'm afraid we can't. I'm not happy with the way my character's being portrayed here.
And it said there would be jelly beans.
What's the matter? You're old, you're frail. If it wasn't for NHS Connecting for Health, you'd probably be dead. Not such a bad thing.
Hang on, you can't speak to Josie like that.
I was talking about her character.
You've been like this all day. You haven't had any patience with our questions, our concerns.
We're not here to have a debate. Please, would you
We're not
just...
debating, right? What we're talking about is the techie.
Just... It's a new...
What about the cost?
Just do it!
Or some sort of system.
His bestie, is he?
Prima donnas.
Me, the actress? Me, the patient? Me, who is not, in fact, a complete gibbering imbecile? Oh, really? How silly. Me, who does actually know how to turn on a computer, send an email, not, oh, I'm a bit scared of all that. Me, who doesn't actually care two hoots about technology or the process or even the cost of the thing, as long as it works, as long as it helps me to get better treatment. Now tell me, does this do that?
I think so. I hope so. Well, it's not perfect. It's not going to be without its glitches, but it's a step in the right direction. A big step.
Good. Thanks for the honesty.
Get off. OK, go again?
I'm ready.
Edward, tell me again why I'm colouring.
Oh, shut up.
Just let me close down my webcam chat with my cousin in Dallas and check my bid on eBay for a new pair of rollerblades. Oh, look. More pictures of my grandson on Flickr.
Thanks, Maggie. That'll do.